Welcome to our session on prenatal diagnosis, focusing on Lecture 8 of HMG 35110B. Today, we'll explore the critical aspects of prenatal diagnosis and its significance. In this session, we'll cover both invasive and non-invasive methods of prenatal diagnosis, including amniocentesis and ultrasonography, and discuss their importance in determining fetal health. Prenatal diagnosis aims to identify potential birth defects or genetic disorders early. It helps couples make informed decisions about their pregnancies, especially if there's a higher risk involved. Prenatal screening utilizes non-invasive tests like ultrasounds and maternal serum screening to assess fetal health. More invasive procedures, such as CVS and amniocentesis, provide definitive diagnoses. Prenatal diagnosis should be considered if specific criteria are met, ensuring the procedure's necessity and accuracy in assessing fetal health risks. Invasive methods like amniocentesis and CVS are performed at specific gestational weeks to collect samples for genetic testing, providing crucial insights into fetal health. Amniocentesis involves several steps, from obtaining consent to analyzing the collected amniotic fluid. It's a detailed process aimed at ensuring accurate results. The analysis of amniotic fluid involves centrifugation and cell culture, crucial for detecting genetic abnormalities. This process is vital for accurate prenatal diagnosis. Alpha-fetoprotein levels in amniotic fluid are key indicators of neural tube defects. Monitoring these levels helps assess the risk and guide further testing. While amniocentesis is informative, it carries risks like miscarriage and infection. Understanding these risks is crucial for informed decision-making. CVS involves collecting placental tissue for genetic testing, offering an alternative to amniocentesis with its own set of risks and benefits. The CVS procedure includes tissue culture and genetic testing, followed by counseling based on the results. It's a comprehensive approach to prenatal diagnosis. CVS carries risks such as miscarriage and infection, similar to amniocentesis. Understanding these complications is essential for making informed choices. Comparing amniocentesis and CVS helps in choosing the appropriate method based on timing, procedure, and risk factors. PGD is an IVF-related procedure to select embryos free of genetic conditions before implantation, offering an alternative to traditional prenatal diagnosis. Blastomere biopsy involves removing a single cell from an embryo for genetic analysis, ensuring only healthy embryos are implanted. Blastocyst biopsy is a more advanced technique, offering higher success rates and lower risks compared to blastomere biopsy. Ultrasonography is a non-invasive method widely used for assessing fetal age, viability, and abnormalities, ensuring no harm to the fetus or mother. Ultrasonography helps visualize neural tube defects, providing crucial insights into fetal development at 24 weeks of gestation. Non-invasive prenatal diagnosis can reveal neural tube defects, such as the meningomyelocele, through detailed imaging. In the late first trimester, structural fetal anomalies can be detected using high-resolution ultrasound, identifying disorders like holoprosencephaly and Fryns syndrome. Abnormal fetal hand detection can indicate a 50% risk for Holt or Ram syndrome, an autosomal dominant disorder linked to congenital heart disease. Ultrasound can diagnose multifactorial disorders like cleft lip and congenital heart defects, aiding in early syndrome identification. Fetal echocardiography is crucial for assessing pregnancies at risk for congenital heart defects, with various indications for its use. Ultrasound can determine fetal sex as early as 13 weeks, crucial for diagnosing X-linked recessive disorders like hemophilia. Parents with a previous child with chromosomal abnormalities face increased risks in subsequent pregnancies, highlighting the need for invasive testing. The risk of chromosomal abnormalities varies with the type and origin, with the highest risk for Down syndrome if a parent has a 21q21q Robertsonian translocation. X-linked disorders without specific tests pose challenges, but sex determination can guide family planning decisions due to high recurrence risks. Prenatal screening relies on ultrasound and hormone measurement, crucial for detecting NTDs, even in families with no history. Screening for Down syndrome involves maternal age and serum testing, crucial for early detection of chromosomal abnormalities. References for further reading on prenatal diagnosis and genetics.